Good morning, honorable members and guests with us this morning from the Ministry of Health. This sitting is resumed. Prior to the suspension of this honorable chamber, we were in Standing and Finance Committee, and to that we shall revert. Honorable members in favor, please say aye. Those against, please say no. Methinks the ayes have it. This honorable chamber will revert Standing and Finance Committee.
This honorable house is in stand. Good morning, everyone. This honorable house is in standing finance committee. Just let me remind you quickly. The honorable minister has 5 minutes to answer any questions posed to him. Members of his team, you have 3 minutes to respond to any question directed to you through the minister. Honorable members of the House, you have 3 minutes. Your questions to the minister should not exceed 3 minutes. And then you're entitled to 3 supplementary questions before you yield to, after which, as a matter of fact, you have to yield to another member. Honorable Minister, I want to start the ball rolling this morning and pick up from where we were when this honorable house was suspended with respect to lots and those lots which are overgrown in a number of communities across Barbados. Particularly, I want to address those that matter because it is a deep and growing concern for constituents in my constituency in various areas. From time to time, you have situations where neighbors, as recently as yesterday, when I visited a particular community, where neighbors complained about the overgrown lot or lots in those areas and how there are times that there have been several times when, for their own safety, so to speak, they have to clean up the lots next door, which produce, sometimes there's vermin coming out of these lots. There's what you call wood ants, which would get in the houses and such like. And therefore, they have to spend upwards, in some instances, of $2,500 to get these lots clean, and they have to do it repeatedly while the owners of the lots are either overseas and do not look to deal with these lots, or they're just here, perhaps living in another parish. Sometimes they're in the very parish of St. Lucie and do not look to deal with these lots. And hence, the neighbors have to take on this responsibility for their own good and well-being. I want to know, Honorable Minister, what is in place with respect to these overgrown lots being left, and how much teeth does the ministry have in relation to dealing with these lots so that people understand that it is their responsibility to keep their lots clean and not just not bother about it. I want to know what within your ministry there is and what can be done to ensure that this prevailing problem, repeated problem, is dealt with firmly.
Good morning, and thank you, Mr. Chairman. The matter you raise is a very vexing and troublesome problem for the Ministry of Health, in particular the Environmental Health Unit. I'm going to speak briefly, and then I'm going to hand over to Minister Ishmael and also Mr. Ronald Chapman, because the Minister is dealing directly with the Environmental Health Department on a number of issues. The problem of overgrowing lots It's been a bothersome one for decades, I can be honest with you. There is, under the health services regulations, there is provision for prosecution, for warnings, for giving people time to clear these areas, and for possible prosecution. This has not worked as effectively over the years as it could have. You also hear, we have been speaking, government, about tightening the regulations. And we have enforced some of these, we've charged some people, but I'm going to allow Minister Ishmael to speak, and then Ronald Chapman. And I will come back if there's anything that I... Thank you.
Thank you, Senior Minister, and good morning, Chairman and colleagues. As Senior Minister would have said in his introduction, this issue of overgrown lots has been a vexing one for many, many constituents of mine, even as you would have mentioned those in St. Lucie. We have overgrown lots all across the island. Of course, we know that we are in a season of climatic change, where we're having heavier downpours of rain, and of course, this then leads to the overgrowth of grass on properties. With that comes, unfortunately, a situation where vectors are able to proliferate and to expand and produce and reproduce. We have, just in the last couple of months, coming on to the last part of 2023 into the beginning of this year, members of the public would be aware that we would have had what you would call a spike in the outbreak of dengue. And of course, in addition to dengue, you have, with overgrown lots, you have rodents infestation and multiplication as well. So this issue is a public health one, and it is one that the ministry takes very seriously. As Senior Minister would have said, there is legislation currently that allows for the prosecution of persons after a series of warnings and consultations and efforts to get them to address and redress the situation. There is legislation that allows for prosecution of persons who persist in allowing their lots to be overgrown, because we understand that this can cause public health issues, and it can cause it can cause problems relative to the wellness of our people. So we are at this point in time utilizing the current legislation to proceed with prosecutions where necessary to address this particular issue. And at the same time, while we're doing that, we are looking at expanding and enhancing those regulations and legislation to allow us to be able to have even more, as you rightly said, Chairman, teeth relative to being able to really bring this matter under control. The Environmental Health Department, as I would have mentioned and alluded to, has several different areas under its remit relative to vector control, animal control, and a whole host of other things, port health, food health, safety, etc. And in particular, the vector health, vector control is one of those areas that we've been paying very close attention to. So I'm going to allow Mr. Chapman to come in at this time to speak not only to the efforts being made under the current legislation to be able to address the current condition of our environments in terms of overgrown lots, but I'll ask him as well to expand on the two projects that we would have kicked off just earlier this year relative to vector control on dengue reduction and, of course, rodent reduction in the city and the south coast of our island. Mr. Chapman.
Good morning, Mr. Chairman. Ronald Chapman, Deputy Chief Environmental Health Officer. So, yes, we acknowledge that there's a significant issue where overgrown lots are concerned. We've had a number of complaints where this is concerned. Now, let me just explain the process quickly before I get into what we are presently doing. Normally, persons would call the environmental health officer, or the environmental health officer goes out into the district, and we see the problem with the overgrown vegetation. We identify the owner, occupier of the lot. That person is then served an abatement notice, given a specific amount of time with which to respond, to abate to bring a resolution to the issue. If that is not done at that point in time, then that person is recommended for prosecution by the environmental health officers. We have been taking this extremely seriously. Over the last 3 months, the minister also mentioned the rodent and mosquito project that we are working on right now. what we have been doing is that we have been serving a number of notices on persons with overgrown lots. To that end, so far we have placed 15 persons before the law court, and we have received judgments in 5 of those cases to the satisfaction of the Ministry of Health and Wellness. The one person actually got charged $3,400 for the lot which they had left overgrown. Now, there are a number of other cases on my desk and which have also already been approved by the minister for prosecution. So this process is ongoing. In terms of notices served, we have served a number of notices across the island. I can't give you exact numbers. One that for sure I can tell you, in the south, in the Randall Phillips catchment, we've served over 63 notices already for this month. Sorry, between last month and the beginning of this month. So we are proceeding apace to ensure that this problem is addressed and addressed in a very resolute way. Now, what the Ministry of Health has also done is to make recommendation for an amendment to the legislation, which would make the process a lot easier. You would appreciate that having to go to court and have adjournments and wait until it's a very time consuming process. And while that time is proceeding, the violation is existing and persons are being inconvenienced, and I dare say their health is being put at risk. So the recommendation makes it a lot easier to address these issues, and it makes it a lot easier to bring resolution and allow Barbadians to enjoy their property even more. Now, with respect to the rodent and mosquito programs, those programs, we started those programs at the beginning of this year, and these were a response to an increase in the number, one, of dengue cases that we have had, and the vexing issue of rodents, which has been we've been dealing with for a period of time. No, those programs continue apace. We have started, let me just say, we have started in the city, and we started from the areas for the rodent, because they're separate programs, although they are being run jointly. We are working from the Oysters Bay Garden, right down the urban corridor, right down to the Brighton's Beach. This is where the rodents are concerned, and where mosquitoes are concerned, this is island-wide. I'm sure that my time is very short, so I can't to go into all the details, but to say over the last month or so, we've seen a fall in the dengue cases. This can be partly due, I would say, to the work that is being done, and I will admit to the lack of rainfall as well. But the fact of the matter is we've been seeing fall in the cases, and this program also is going to work in tandem with Cricket World Cup to ensure that by the time Cricket World Cup starts, we have a city that is relatively free of rodents and mosquitoes. Thank you.
Mr. Chairman, with your permission, I just want to ask the CMO to speak on this matter as it relates to dengue fever.
Certainly.
So, as you are aware, we announced a dengue fever outbreak in October of last year, and we have been managing the situation to the best of our ability. The levels and numbers have come down slowly. It's not a precipitous return to normal, but we are still in outbreak mode. But we are in a much better place than when we started. We have had 2 deaths associated with the dengue fever outbreak, and hospitalizations with serious outcomes for dengue, like shock and hemorrhagic fever, have been fairly well controlled. So we are certainly in a better place with respect to where we are with dengue. And let me just take this opportunity to report that COVID numbers remain low in Barbados. And the spike we had in respiratory illness about 2 or 3 months ago, those have also trended downwards. I don't know if Dr. Rollock, she has much more technical information on the dengue fever, and she can probably be allowed to speak if so desired. Thank you.
Just say your name again, I didn't. Say your name again, I didn't hear you. Okay.
Were you able to hear me? I'm sorry. Should I start over? I'm so sorry. Okay. So the advice to householders and from the Environmental Health Department to get rid of the larval forms will help to bring down the number of cases that occur, but to actually stop the outbreak, we need to kill off the adult mosquitoes that contain the virus. And for that, we need space spraying, usually with what we use is malathion. From the peak in January up to 500 cases, just over 500 cases, we've recorded, I'm sorry.
Officer, I hate to interrupt you, but we certainly cannot be selfish. I was hearing you at the outset, but because of the system we have, so you'll have to start at the top and go so that because it wouldn't have been recorded and for Hansard. So you have
3 minutes again.
additional time to be able to get the record. So you were fortunate this morning to get your message across.
Thank you so much, Chair. The name, Leslie Rolla, Senior Medical Officer in the Ministry of Health and Wellness. As I will start again. Dengue is an endemic illness, which means all through the year, we will have cases. From time to time, according to the conditions that occur, the number of cases will go over a threshold and we will say that we have an outbreak. This breach of threshold after 2 years of no recorded cases occurred in October 2023. And from persons that were tested at the laboratory, we realized that 2 types of dengue viruses were circulating, subtypes 2 and 3. When there are multiple subtypes, there is more likely to be severe disease. So we advised practitioners and offered online training through PAHO to recognize the warning signs of severe dengue. So even though October, November, December, so far cases have peaked in January 2024 with over 500 cases, we've had more hospitalizations as expected because persons are recognizing warning signs and bringing persons to hospital, but we've had very few deaths. And the deaths have occurred in persons that have other comorbidities, other illnesses that make them more likely not to survive the severe stage of dengue infection. Since that peak in January, in February, we've gone down to just under 350 cases. I don't want to call the wrong number, it's about 342 in February, and we're hoping that that will continue in March. To actually stop the outbreak, we need to kill off the adult mosquitoes that contain the viruses, and to do that, we need to fog. But to prevent new mosquitoes getting infected, we need householders, and we've asked them, as well as the Environmental Health Department, to look for the larvae in cases where they might be breeding and destroy them. So we've recognized that there's been an outbreak, we've been speaking to the public and encouraging the catchments with the staff that they have to actually go and do the inspections, look for the larvae, throw them away, scrub the containers, and for the fogging to occur in the areas where we will always have mosquitoes, but where there seems to be a press of Aedes aegypti mosquitoes. When the rain falls and mosquitoes breed, we will have Culex mosquitoes as well, but fortunately they do not carry dengue. So even though they're a nuisance, they will not contribute to the problem. Thank you.
Thank you. Minister, I just want to, I know that you cannot legislate culture and how people operate, but I just wanted, this just came to my mind, in relation to the lots, the overgrown lots. People use overgrown lots to do a lot of things that are not correct. For instance, we talk about the bush, there are persons, and we've had situations where persons drive from wherever they live and they dump the carcasses of dead animals in bush and such, like, which then becomes an inconvenience to residents in the area. Would the legislation that you're looking at cover this if these persons are caught as well?
It is other legislation, if I remember correctly, under to deal with people who are caught dumping illegally. And I think this comes under the Ministry of the Environment primarily, which is different legislation from the one. We're expanding the health regulations to, rather than charging, to see if we can deduct the cost of clearing the lot from your land tax. As it relates to dumping illegally, that comes under different legislation on the environment. And there are penalties for that. I think you can even be jailed for it, if I'm not mistaken. But that is different, separate from us.
Yeah, yes, I understand. But I'm referring to the carcasses of animals, which then becomes a health threat to persons in the vicinity of where this is dumped. But I know it's a thin line between your ministry and the Ministry of the Environment. So I just want a little, clarity.
Yeah, there's clarity. For the most part, certainly on the part of the Ministry of Health and Wellness, the environmental officers would normally deal with it and are not hard for us, but to give the information to sanitation and within the EPD department. But for the most part, there is that collaboration. Perhaps Mr. Chapman might want to add a sentence or two in that regard.
Yes, Mr. Chairman. So yes, there is legislation there to deal with some of these issues, and the legislation is shared between the Ministry of Health and the Ministry of the Environment. What we will be proposing a little later on this year is some additional amendments to the legislation, which will not only deal with littering, but deal with some of those issues that you have mentioned. Now, there is legislation there for illegal dumping. The challenge, a lot of the times, the challenge is trying to hold someone accountable for it, because a lot of it, you would appreciate, a lot of this stuff is done at night, and it's done in very clandestine areas. And unfortunately, persons tend to think that where there's a hole, they need to fill it with refuge. And where there is overgrown vegetation, they need to put refrigerators and other bits of foolishness, I call it, in the dead animals and so on. So when we do catch people, I think there is history where we've shown that where we have caught persons, and we did take them to court, and there were others that were caught, and they were required there and then to clean the areas. So we found persons who've been dumping in the past, and they not only cleaned the area that the amount that they dumped, but because the area was an area that was prone to regular dumping, they cleaned what other people dumped, because at that point in time we can tell which we can put a name on the garbage, so they cleaned the whole thing. So, but the issue is trying to find or to catch them in the process, and I believe that the recommendation for this new legislation will help us significantly in addressing this problem.
Thank you, Minister. I certainly want to congratulate you and your ministry for what you're doing with respect to these issues raised, and I look forward to that legislation being passed, coming to Parliament to be discussed and to be passed, so that persons understand that it is not just a situation where you can get away with the things that they have been accustomed getting away with, but that we truly operate as responsible citizens. And I am certainly appreciative of the work that you are doing within the Ministry of Health and Wellness, you and your fellow minister.
Thank you, Mr. Chair.
Honorable Member for St. Philip North.
Thank you, Mr. Chair. First of all, I want to say good morning to the ministers. It's on. To the ministers and the entire members here entering the well of the Ministry of Health / Queen Elizabeth Hospital. I want to say publicly that it was indeed a pleasure working with you. Every single day of the 2 years I was there was a learning experience. You taught me a lot. We got some stuff done, and I enjoyed it. And let me say here again, by no means possible were you the reason for my resignation from the ministry. I want to start a little easy here to discuss taxes. We are all aware of the NCD fight that we as a country are facing. We are aware that the public is contributing very nicely to the fight as well. We would like more of it, but it's there. We contribute with respect to the health levy. We contribute with respect to the sugar sweetened beverage tax, which was added because of it, and we as a government increased it. I would like to hear a little bit about the outcome of the sugar sweetened beverage tax, if we know any figures that are available, and if any thought has gone into applying that particular tax towards helping with the actual NCD fight.
Thank you, Honourable Member. You've raised a very interesting area, and as it relates to these taxes, I'm going to ask Dr. Arthur Phillips to speak about it, but before he does that, I know that there has been a review of the sugar Swedish sugar sweetened beverage tax. And there's a proposal, perhaps he will mention it, I'm not going to be bold enough to mention that proposal, but you are correct, we've had, and the discussion came up to some extent, yes, on Wednesday evening, the whole matter of financing healthcare. In that project, I think you're aware, one of the recommendations is that some of these taxes, be it tobacco, alcohol, sugar, sweetened beverage, should be be allocated to financing, having to finance healthcare. But it's an interesting discussion, but in terms of the results, and I know some work was done by the University of Western East, and I hand over to Dr. Phillips, sorry.
Good morning. Arthur Phillips, Deputy CMO and NCD Focal Point. The issue of taxes and NCDs is an interesting one. Certainly taxes have the potential in very broad terms to influence behavior both on the consumer and the manufacturer/distributor side, as well as to generate revenues, all or some of which could potentially be allocated to social care, including health. More specifically on the issue of the sugar-sweetened beverage experience in Barbados and our taxation of the sugar-sweetened beverages, we have had an interesting experience, starting as we did as one of the relatively early countries, starting as one of the early countries in introducing a sugar-sweetened beverage tax at country level. There certainly was literature as well as theory that indicated that SSB taxes could have a beneficial effect on harmful or excessive consumption. So with the 10% tax, Ministry of Health would have led on the standing up of a sugar-sweetened beverage evaluation committee, the membership of which would have included civil society, academia, both on the health and the economic side, as well as colleagues in the Ministry of Finance. And that initial evaluation resulted in findings inclusive of academic publications, and in short, it indicated that the 10% tax resulted in several things. One, a partial passing on of the increase, or partial absorption, I should say, of the increase. An increased price, yes, and there was some decreased consumption. And more specifically, over the period evaluated, there was a 4.3% decrease in weekly SSB sales compared to what would have been predicted for that period. There was a decrease within that of carbonated SSB sales, 3.6%. There was an increase in non-SSB sales by 5.2%, and there was an increase in sales of bottled water by just over 7%, 7.5%. There were some issues that were noted. Clearly, some consumers switched from higher cost SSBs to lower cost SSBs. And in the initial rollout, there were some SSBs that were untaxed, drink mixes, etc., flavored crystals. We are operating in the context of additional guidance, not only from our local experience and our publications, but WHO has issued recommendations on sugar-sweetened beverage taxes, and there is a literature that speaks to health taxes and how they may be best applied. We are fortunate in that there is a level of policy coherence between ourselves and Ministry of Finance on the idea that taxes can reduce consumption and generate revenue. And the evaluation of the 20% tax is ongoing, and the areas that we are particularly looking at understanding and advising on relate to a tiering of the tax, or the tax increasing with increasing levels of sugar content, as well as the issue of allocating at least some of the revenue to social programming for two reasons. One, in terms of just additional revenue being available, and two, also being able to help the public understand the reason for the tax and demonstrating to the public the tax being used for this purpose. I'll pause here. Thank you.
Is there any idea of the revenue thus far?
I don't have those figures to hand. Sorry, I can look for them.
Thank you.
Unfortunately, we don't have it here.
Okay. My next question, I listened to the chairman of the Queen Elizabeth Hospital board when you first started, and it was interesting to hear you speak about, through this chair, of course, speak about how the CEO was chosen. I just had a couple questions on that. We all know that the QEH, let me begin by saying, if we want to admit it, that the QEH has a culture of its own, so to speak. I find it, I was fascinated by how you revealed that a survey was put to the staff to decide what type of CEO to be chosen. I thought that was interesting, but the question I have that I want to ask, and I know the answer, is why the directors of the hospital who have had myriad experience in the function at the executive level of the hospital. I'm not too familiar with the board. I was never involved with the process of choosing board members, so I do not know how many of them had experience working in an executive level at the hospital directorship level. I'm curious to know why the directors were not included in the choosing of the CEO for the hospital, considering that they more know probably what they want in a CEO. Some of them have actually acted in that position before, and I found it interesting that they were not included. Any answers?
Thank you, Honourable Member. I will ask the chairman of the board to respond to you.
Nigel Whitehall, Acting Chairman, Queen Elizabeth Hospital Board. Honorable Member, I use the generic term management. The management was surveyed. Management included the executive directors.
I know about the survey. If I were hired because of a survey, I'd consider myself lucky. But I'm wondering why they were not on the panel, for instance, for interviewing or for choosing, going through the applications for choosing the ones that they saw fit. A survey is one thing. I know what I want in a CEO if you surveyed me, for instance. But I'm interested to know why they were not included.
I think from a management perspective and from this perspective, the junior ought not to be engaged in the selection of the boss, of the person who will manage you. That is a management principle, a basic management principle. The juniors are not ever engaged in the selection of the manager. That is done in the reporting structure. That is done according to a reporting structure, the management reporting structure, which we would probably call the organogram. So a management specialist might say that that is inconsistent with the behavior, with proper management behavior, and does not lend to proper accountability within the organization. So in those circumstances, I think the board pursued an option, pursued the course which is consistent with proper management techniques, proper management principles, and not allowing the junior members to be involved in the selection of the CEO. That's my view.
I'm going to let the PS speak to that too, as he was part of the committee.
Good morning. Wayne Marshall, Permanent Secretary, Ministry of Health and Wellness. In answer to your question, Honorable Member, it is not a best practice in terms of selection, as the chairman mentioned, to allow persons who are supposed to be basically under the charge of someone else to be in the actual selection panel. Now, what happened is that in the process of selection, these persons were included in terms of determining what specific attributes and character the CEO would have. But in terms now of allowing somebody to select somebody that's supposed to be their supervisor, that's not the best practice in terms of human resource management, and certainly not the policy of the government of Barbados.
Okay, I won't delay, but I think it opened the eyes of some of the directors that sit in the room, because oftentimes I was asked the question. So I'm sure they're happy now to hear some semblance of an answer. My last intervention is with respect to the geriatric hospital, the new geriatric hospital that is now being constructed. I remember as a secondary school, maybe primary school student in the geography class, we often spoke about the water tables and the risk of pollution of the water tables and the reasons for not building in certain areas or doing certain storage in certain areas, for instance. We were familiar with the zones, and for which I understand are changed now to instead of 1, 2, 3, ABC now. But I've been asked, and I was scampering for an answer as to the choice of the location of the geriatric hospital, when I am aware from several years ago that that was considered. I know the zone 1s and 2s. I can't speak about the A's, B's, and C's, but I know as a student that that was considered to be a zone area where building was not supposed to happen. I have been asked by constituents far away, not only in St. Philip North, on the rationale. I've been asked by members of certain ministries, and I have asked them too, and nobody can give me a half-decent answer. I'm not only speaking of sewage seeping into the water table, I'm speaking of paint, for instance, leaching in, hydrocarbons leaching in. If you're gonna do a car part, the products used there, the oils and so on, leaching into the water table, the aquifer that we have there. And I find it very confusing. The area is near the highway, so there are pollutants with respect to the air quality of the the new geriatric hospital. And I am also aware that there had been a previous, at least I heard, so I could be wrong, correct me if I'm wrong, there have been a previous site, maybe not in this administration, but another, for which would have been safer to place the new geriatric hospital under. I mean, there are other issues, but we'll deal with that part first. The other question I have is the funding. Who's providing the funding for the building of the geriatric hospital? I need to be clear. Yes, we need to look after our old people. All of us will get old once we want to live. And I want to see them and the surrounding districts in the healthiest possible position for them and the surrounding districts in terms of water quality, air quality, and everything else that goes along with it. So if I could get some comment or answers, I'd be grateful.
Thank you, Honourable Member, and certainly I will try to answer you as best I can. As it relates to the zoning, I'm not clear. I know part of the bill is Zone 1 and parts are 2. I'm not certain. I'm being told it's called Zone C now. So I'm under the impression that it was in Zone 2. Originally in the original numbered zones. But in any case, the point you've made in terms of contamination and seepage, that has been taken into account from what I've seen as it relates to the design. It's supposed to have its treatment plant and it's supposed to have its sewage treatment plant. And there's obviously water we use to do the gardens and the lawns, etc. From what I recall, as it relates to designs they've made, they're mindful of all the things that you mentioned in terms of seepage of hydrocarbons from vehicles being parked. And I remember reading of some design in the car park area that would allow for the collection of any visas, etc. As it relates to ventilation, I know that there's, because elderly people don't like air conditioning, it's being constructed in such a way that you'll have a lot of natural ventilation. The issue you raised about proximity to the highway, that has been considered, and I know they plan to use burns and trees to dampen the noise, and obviously to kind of provide a blockage for whatever particles there might be. As it to the other area. Now, before the funding, there was something else that you asked. Had to do, I guess it was the proximity to the thing. And you said that there was alternative sites. I'm not certain. That would have been before my time. But the funding, as far as I know, is coming from central government, as far as I know. And the estimated cost for phase one, it's being constructed in 2 phases. The estimated cost of phase one is about 110 million, I believe. And when that is finished, that'll come 300 beds. And phase two then is to accommodate another 108 beds to be able total occupancy of 408. And of course, it will have daycare facilities. It's expected to have paths for all people to walk and to exercise. It is supposed to be much more than just a hospital as it is now. It's supposed to allow them to live with dignity and to have active aging and indeed healthier aging. So that is as much I can tell you. Thank you.
Overhearing the crosstalk from the other member that sits in front of me, I remember, just clarify, was it a zone 1 before and now a zone C?
Was it zone 2? Because I live in the area too, and my area is zone 2. And under the new classification, it is a zone C, sorry. But in zone C, they have to have provisions as it relates to oils and stuff like that and disposal of those things.
All right,
so they had to do a special.
All right, I don't want to belabor it, but I want to be clear in my head. I might not be slower, I might be slower than a few. So zone 2 was what? An area you don't build on?
I live on zone 2, so traditionally, zone 2, they allowed, it was agriculture by and large, largely agriculture, and you divided into lots, in the large acre lots, because they didn't want as much as housing. But over time, that was not adhered to, more in breach, because you had the developments around Licorice Village and all these places. And we know how close they are to and they overlap with zone 1 and zone 2. So we talked about these things, but then over time we discovered that at one stage you were talking about not building, but as time went on, that was back in the 50s because of the nitrates and all of this that you were particularly concerned about. Back then you were concerned about bacterial survival in the aquifers and in this, because it is coral limestone, it's like a sponge, so you get diffusion of water at different rates. And you were concerned about the time it would take for bacteria to survive. These days, with the proliferation of using farming and animals grazing, the issue is turned towards the control of nitrates in the water. And we have, in terms of WHO, have at times even gone above the maximum level. So the focus is now more on chemical contaminants there. And it was felt that the strict zone 1, 2, 3, 4 had to do with bacterial circulation, whereas now we're looking at nitrates, particularly in a small country that needs to do agriculture. And you have cows and sheep grazing, and they add nitrates, considerable amount of nitrates to the soil. So it's become a bit more complicated and complex.
All right, your explanation.
I don't know if Mr.
Yes,
Chapman
I would
wants
like
to
to
add
hear.
something, perhaps.
Ronald Chapman, Deputy Chief Environmental Health Officer. So zone 1 was originally restriction on building. Zone 2 Pardon me?
Because? For zone one?
As the minister has said, in the earlier days, we looked at the travel of water. It was said that it would take approximately 90 days for water to travel through the zone, to travel through the aquifer to meet where the extraction well was. And the time expanded as you go further away from the well. So the zones would move from zone 1, which would be 90 days, zone 2, zone 3, zone 4, and zone 5. The zones have been reorganized. However, specifically, zone 2, originally there was not so much restriction of building. You obviously, town planning would vet the building, but there was specifically controls with reference to the disposal of waste. So you would find that in zone 2, you had to have a septic tank, and that septic tank then went into what is called a tile field, and so on, as opposed to a suck well, which is normal for zone 3 and other places in Barbados. The minister is quite correct. What we are dealing with now, not so much is, well, we are still dealing with microbes, but a lot of the times we are dealing with now a lot of nitrates and other issues. So the reclassification of the zones allows us now to use present knowledge to make those changes, as well as.
So zone 2 is equivalent to zone C or zone B?
I think the zone 2 now is a zone, has been changed to a zone C. The zone 1, what was once zone 1, has also been changed. So what I can do is I can provide you with that information, but there has been a complete change of zones, and in some cases, some zones were made smaller, so that you don't have the exact same area. So it's not like we took zone 1 and just renamed it as zone 2. The zones were completely reclassified. So you have new zones and not the same old zones you had before.
If I may, zone 1, the past zone 1 is now part in A and then part in B, and the past zone 2. So there's overlap in the new classification. Yeah.
Okay, I will do my research because I hardly come in the house without knowing the answers to the question I'm asking. I find it interesting that a zone 2 or 1 could just up and the aquifers apparently move to a different area to cause the zoning to be different, but that might be just my thinking. That's it for me, Mr.
I believe
Chair.
that you
I
have
will
it
do
in
some
reverse.
research
There's
on my own.
There's there.
Thanks.
Thank you, Honorable Member. Honorable Member for the City of Bridgetown.
Thank you very much, Chairman. And let me take this opportunity to tell you, to say a good morning to you, Senior Minister, colleagues, and officers of the Ministry of Health and Wellness. I want to start with a sincere congratulations, not self-congratulations, but sincere congratulations to this ministry for something that has daunted me for a very long time as a youth advocate till now, where I used to, in the back of my mind, refer to this ministry, not in a derogatory way, but as a ministry of sickness, as opposed to a ministry of health, because primarily you're dealing with sickness. What I've seen over the years, even when you look into the estimates this year, you see a lot of preventative programs, you see a lot of wellness programs. So what you're trying to really do is to keep people healthy, prevent them from getting sick, as opposed to just almost exclusively dealing with sickness. And that is something that I can tip my hat to. Last year I wanted to ask a question on this because they did a specific comparative analysis between the developed world and Barbados and the Caribbean in relation to how much money they were spending per percentage on prevention. And I've seen that we've increased that over the last 3 estimates that I've been able to participate in, had the privilege to participate in. So I want to start on that note, congratulating you, Senior Minister, and your team continue to move in that direction, which I believe is the correct direction. When you look at the statistics, sometimes I've heard, I could be wrong, I could be corrected in the course of an answer, like 80% of the deaths are through lifestyle choices, NCDs, things that can be prevented. And that's a lot. And it speaks to particularly our working population and the entire population as well. But it brings me to my first question, serious question, and that is in terms of what I find happening globally, but specifically in Barbados in relation to mental health. Depression, all types of mental health. What is the ministry's plan, or what can the ministry tell us in relation to the improvement of mental health? I don't want to get too specific, but as I look into sub-program 0377, I see stability in numbers. So it tells me that we may not have major plans because we may not have major resources. My concern as the member of parliament that represents the city, on numerous occasions I have people who have mental episodes to the naked eye. You call a community health nurse who will be able to diagnose it from a professional level, and they many times have to confess, if they're honest, Corey or MP or minister, we don't have the space. Sometimes we get difficulties with the police service in terms of picking up the people, but even when that is done, 2 tools, you see the person's back out, and the cry is we don't have the space. So if we don't have the space physically, and then I don't see the space fiscally, I know that we can have a continuous problem. So I just want to put to the ministry, what is the medium to long-term plan, particularly, but what is the plan generally in relation to the serious issue of mental health that the world is going deeper and deeper into?
Thank you, Honourable Member, for your question on mental health. I'm going to ask Minister Ishmael to start, and then I will add, if there's anything to add, and then I'll go to Mr. David Leacock, the manager, to speak specifically to the projects planned for this year.
Thank you, Senior Minister, and thank you, Honourable Member from the City of Bridgetown. And I thank you for raising the question, because mental health is one of those dimensions of wellness. Mental wellness is one of those dimensions that we at the Ministry of Health and Wellness have been focusing on. As you rightly said, the ministry is not a ministry that is designed to focus on sickness, but is really supposed to focus on the health and wellness of our people. And mental health is one of those very critically important components of overall health and wellness. We would have noticed post-COVID, I think, if I'm not mistaken, and Mr. Leacock can correct if I am, we've noticed a 700% increase in the numbers of persons since COVID till now who have been seeking the services at the psychiatric hospital for mental health related issues, and within the clinics as well, the polyclinic setting. And this means that and I mean, even without statistics, I think the average person in Barbados understands that COVID was a very traumatic experience for all of us as a globe, as a world, as a people. And therefore, mental health has taken on, I think, even more an increasing state of awareness across our populations. It is important for us to understand that there is still within the context of Barbados a significant amount of stigma associated with mental health and wellness. And whilst that is the case, the Ministry of Health and Wellness is purposefully and in a very dedicated and intentional way and going about and seeking to introduce an anti-stigma campaign that will help us to reduce the levels of stigma associated with this aspect of mental health and wellness. There are persons out there that are battling many different things, whether it be depression, whether it be suicidal ideation. It could even just be a bout of sadness that is going on for a little bit longer than one would like. There are many different things that are plaguing persons from a mental health perspective. And there are persons who are hesitant to reach out for help because they think that if they were to call someone or they were to ask someone about what they're feeling and what they're experiencing, that it means that they're going to have some sort of description applied to them for the rest of their lives. But what we've noticed that in spite of that, and because of COVID, and because of many persons understanding and appreciating the importance of mental health and wellness, persons are reaching out. So that's why we're getting that increase in numbers. But there's a lot that's been taking place within the ministry, and Mr. Leacock will expand on this. But right now, there's a, and Senior Minister as well, there's a review of the Mental Health Act, which is going to help us to better appreciate the realities that we're now faced with in this current world. And we're working with many of our strategic partners, PAHO and others, to help us with that review. We have also created a hotline just recently and launched that's called Lifeline Barbados. And the number for that hotline, Minister, Honourable Member, for the city and for the benefit of the public, is 536-4500, 436-4500, and that's Lifeline Barbados. And once again, it is not for, only in extreme cases, but even if you just want to talk to someone, you feel that you need to have some level of support, if you just want to just talk out the situation that you're currently facing and dealing with, you can call Lifeline Barbados and you will find someone there that will be able to assist you during that traumatic experience, or during that season of discomfort and disquiet. There are many other things that we're doing. There are many activities that are being done. There's a suicide prevention action plan. There's a workplace mental health and wellness action plan. There's also a psychological first aid training action plan. And there are about 6 different action plans that we have right now in train for the Ministry of Health and Wellness to, as you rightly said, to tackle this mental health situation and to bring it to a place where it is under significant control. I'll stop there at this point in time. I'll allow Senior Minister to come back in, and then we'll go from there.
Thank you, Minister. I just want to add that the ministry attaches great importance to mental health. And I believe since 2005, 2006, we had our first mental health reform plan. And we, regrettably, almost 20 years later, we are still at the concept of having a consultancy working with us through PAHO to develop and implement this plan. The minister is correct. There are a number of areas we have to look at. We have to look at the outdated legislation, which needs to be modernized, and that is being worked on. There is the matter of the facilities in which we accommodate those who have mental illnesses. And we need to look away from the custodial type facilities of 100 years ago and certainly look to modernize. This obviously can't be done all at once, but in this direction over the last financial year, there was an upgrade of the rehabilitation therapy unit and also the occupational therapy unit, and we're trying to modernize gradually and not looking at everything all at once. Also, as it relates to this, we recognize long ago that the need to move towards community mental health care. We're getting clinics involved in mental health care. I think we made some further progress this past year. We had the addition of about 4 counselors, I believe. We got additional counselors and 2 psychiatrists, I believe, to help us in this outreach into the polyclinics. And you're seeing larger numbers of persons seeking assistance at the polyclinics. Another positive move in this financial year has been for patients being able to get the medication at the polyclinics, as opposed to having to go to the psychiatric hospital with all its stigma attached to it. There's always the need for human resources, and as we move in this direction, we will need to increase our number of nurses. The training of nurses in psychiatric nursing had gone into abeyance. I believe it has resumed now, and there's a new push to get persons more interested in psychiatric nursing. Always need for psychiatrists and counselors to assist in various ways, but importantly, in the areas of occupational therapy, we definitely need to recruit more persons. Going forward, as part of this modernization, we'll have to utilize information technology, and I know that the psychiatric hospital has plans to move in this direction. We'll have to look at accurate data, we have to look at research. And with all this, to bring all of this together, we have the Mental Health Commission. So it is not lost on the Ministry of Health what is required as it relates to mental health illness. And that is a real challenge, and especially after COVID, we saw the increasing numbers of cases. And I'm going to ask Mr. Leacock to speak now specifically to some of the projects which Minister Davidson mentioned earlier, which are the things we plan to implement going forward. Thank you, Mr.
Good morning. David Leacock, Hospital Director, Psychiatric Hospital. Thank you, Minister. Remember, you raised a few points, and I will speak to some, and I'm not going to speak to the others. Now, as far as what we are doing at this point in time, we recognize definitely that there is increasing demand on our services at this point in time, and some of this came up post-COVID. We will say every situation can be seen as opportunity, and COVID definitely brought to light the needs as far as persons are concerned when it came to mental health, and making it more acceptable for some persons to actually reach out and seek mental health services. So from that end, polyclinic-wise, we are seeing a definite increase there as far as our persons who are requiring services. Hospital-wise as well, we are also seeing increasing persons coming to hospital to also access services as well. From an admission standpoint, we have not seen a significant increase admissions-wise, but we have, as you said, not returned to, let's say, pre-COVID numbers for admissions. But as far as seeking services, increases are definitely there. Dr. Clark can speak to that as we go on. As far as Minister mentioned, we are trying to increase the number of persons who can be seen at the community level. So we are, from our outpatients department standpoint, trying to increase the persons going out to our clinics and be seen there as opposed to be seen institution-based at the hospital itself. Community integration, we are, with the drug services help, having most of our patients now at the polyclinics being seen there and receiving their medication directly from the polyclinics. So that has seen a significant change as far as how we operate at the hospital, at the polyclinics as well is concerned. During the course of the last year, we would have seen about 200, 300 persons migrate from the hospital clinics to the polyclinics and be seen at the polyclinic as well. So community integration is happening at that level. Secondly, first aid. During 2022, we had 160 persons trained in this area. And this was targeted at our first responders, some of the persons in the schools, the fire service and other agencies as well were trained in psychological first aid. This is to assist persons in disasters or day operations, to see persons who are in need of immediate interventions and to know how to help them or how to direct them towards getting help. During the last year, 2023-2024, we've also had additional 160 persons trained through a consultant. We are also at present having another 160 trained through the Barbados Red Cross Society. So we are partnering with civil society towards getting more persons trained in this area. And we are also budgeting for the next financial year to also expand and have another 320 persons trained in this area as well. Mental health action plans. Minister Ishmael mentioned that we are having 6 action plans to address varying areas. These action plans require we work with Ministry of Labor, with the Ministry of Public Service, Ministry of Health General as well, and other agencies as well. We started with government first and then working our way out. So the action plans, as a workplace wellness, for example, we are working towards having everyone understand basic mental health. What is mental health? What is mental wellness? And in turn, from a workplace standpoint, how do we ensure that we make workplaces mentally safe for persons to go into and to work every day? So that is one area we're working on. Minister Ishmael also mentioned the anti-stigma campaign. If we in turn want to have persons accept persons back in the society after they've been had intervention from our end, we have to change how persons see mental health and see mental illness on a whole. So from that standpoint, the anti-stigma campaign is designed, is going to have its full launch or rollout by the end of this month, going into early April. So you should see a lot more of the media as it relates to mental health coming very shortly. So we have, from a social media standpoint, started a small rollout, and we will have official launch by the end of this month into early April. MH Gap training, mental health gap. What this is a program that allows for non-psychiatric trained persons to be able to give mental health care in a more holistic manner. So during the course of the last year, some of our clinicians were trained as trainers to in turn train other practitioners at the polyclinic level how to deliver mental health services more humanely and according to what we see as best practice. So Dr. McClatchy himself has been trained, and the other consultants are also from our end and QEH, we're all trained in this area. And we're hoping that within the next year to see mostly polyclinic staff be trained in this area so they can identify persons a lot earlier.
You need to wrap up your response.
So, I would say there's a lot of things that we're trying to get done, and hopefully we can, you can see from your end as well, Minister, and the city, what we try to roll out to benefit all Barbadians as we go forward.
Right, Mr. Chair, it means that a lot is going on, and that's why you will get these types of answers. So I do
Yes,
appreciate it.
indeed, a lot is going on, but we have to still be concise with our responses and questions, etc.
Correct.
So that
Time
we
is of
manage
the essence.
And we can get through the head. We have a lot of things to know about health. Thank
Correct.
you.
So I will quickly go on to my next question and start that with really advocating officially that I believe that the mental health area, through the Ministry of Finance, the Ministry of Public Service, find it to really get some resources to improve the medication, the community care, the space where necessary. If you do a survey of the homeless and the vagrants, you realize that there are lots of mental health issues there. And I will also advocate that we can use and reach out to the non-governmental organizations, the NGOs. You see a budget here of $60,000 to that. And if I know the work that NGOs could do, Red Cross, St. John, Ambulance, etc., is a paltry figure. We could put in a little bit more and get a lot more out. My second question really speaks, though, to one of my most testing tribulations with the Ministry of Health through the QEH, and that is the incinerator. And I asked today on a different level, I actually asking representing people today in relation to a specific question on the incinerator. Now, in recent times, we've seen great improvements where the incinerator is concerned, but from time to time, things get really bad. And the incinerator bellows out black smoke with an odor, and my phone lights up, and it can be complaints as simple as I have to rewash my laundry, but it can go as serious as I feel like this is a life and death situation where I need to seek care to be nebulized because I have serious respiratory issues or acute asthmatics. I think I know the history and the stories and stuff like that, and I could skip that, I have that, because this is not just a question that was asked already this time or asked last year. I've actually asked all three estimates of participating in. I will probably continue to do so. I probably wouldn't have to continue to do so because the issue could be starting. Now I understand that the long-term solution or the medium-term solution is really changing the incinerator. Whether we use some or getting a different type of advanced technology that is environmentally and sustainably friendly. What I want to ask today is specific, and it has to do with the short-term solution, where I am made to understand that sometimes the incinerator is overloaded, and that is what causes those very dark days, figuratively and literally, for a lot of the residents of River Road, Spruce Road, Commermere Street, Vine Street, Nelson Street, and surrounding areas. So I just want to ask a simple question, Chair. What is being done and what can be done to ensure that the incinerator is not overloaded to prevent the inconvenience or the residents feeling as though they have a life and death situation on their hands due to this very dark, odorous smoke? Thank you.
Thank you, Honourable Member. I think we all share your concerns about the residents who regrettably and unfortunately reside downwind from the incinerator at the QEH. As I said on Wednesday, the incinerator is quite old. It's over 30 years. It's gone way past its life expectancy. We have been working and repairing it repeatedly over the years. You said that every day your phone lights up. For clarity, I'm just trying to be curious and find when was the last time your phone lit up because of concern about the vein.
Right. I could probably give you the date, but I will tell you a few months ago.
Okay.
Yeah.
So you admit that there is some improvement, and we are clear about that. The QH Engineering Department has been working really assiduously with this whole matter. They're concerned. You mentioned the overloading. I think they've introduced a protocol as it relates to that. They have done work recently which in terms of changing scrubbers and stuff like that. And I know that during that time, and it was a few weeks ago too, people weren't even sure that the incinerator was lit. I'm going to ask the Director of Engineering to speak extensively on this. I think I mentioned on Wednesday our plans going forward, consultancy to look at the management of medical waste in this day and age, as opposed to in the 1970s or when it was 80s, when that incinerator was installed. This consultancy looks at how the types, how it is managed within the hospital. It looks at the storage and transportation, etc. And then it's going to be looking at the technologies available and what is best recommended and possibly suitable to take these people out of this terrible, the misery from time to time, and get it solved once and for all. I believe it is expected that if all goes well, this would all be finished in, I believe, a year and a half, Ms. PS. But I'm going to ask the Director of Engineering to speak to this matter in detail. Thank you.
Just for Hans, say the last time the phone blew up was the 4th of December. 4th of December, yes.
Good morning, everyone. Paula Agbo, Director Engineering Services, Queen Elizabeth Hospital. Honorable Member, with respect to your specific question, I think that you would appreciate that the incinerator is quite old and is way past its end of life. And we did explain previously that we are in the process of going through the process of the change out of that particular piece of equipment. You specifically asked about the overloading of the unit and what happens. And I think that it is not quite accurate to say that it is the overloading of the unit, but what happens what happened previously, you said your phone blew up in September, is that we had a situation where the afterburners needed to be repaired. So those afterburner parts were on back order, and they took some time to get here because of the age of the unit and the accessibility of parts for the unit. There are not very many sources for those parts, but we were able to get parts to repair the afterburners, and the afterburners were repaired. Subsequent to the afterburners being repaired, we would have found that there was not that black smoke, as you mentioned, that would be emanating from the unit from time to time. However, what we have found is that because the unit is quite old, there are different issues that arise, and from time to time, the afterburners may trip, or you may have other issues with other parts or sections of the incinerator. And as a result of that, you will find that you may have that smoke arising. It is very difficult to control with a first-generation unit that is 33 odd years old. It is very difficult to control the exhaust from the unit, given that the unit did not have specific sections in it to do any cleaning of the exhaust from this first-generation unit. And so we have tried many interventions to try to alleviate the challenges for the neighboring community as well as for the persons within the close environs of the incinerator within the hospital facility itself. As Minister said, we are actively engaged in the process of examining the new unit, and that will be a green technology. And obviously then the challenges that we're currently having with the black smoke will not prevail once that has been installed. We expect that this process will be about 18 months or so, and that obviously it is not a short project because we have to go through an extensive process, and there will be construction, well, apart from sourcing and determining the equipment, there will be construction and installation and training, and then some of our protocols may change as it relates to the sorting and things like that of the waste, as well as the provision for refrigerated storage and storage so that there's not this 24/7, 365 days of burning of waste. And so we are very hopeful that with these interventions and with this plan, that we will be able to alleviate this problem for the city and for the constituents of the country very, very shortly.
Thank you.
I thank you so much. Communication, tell people, is key, not just in a marriage. What I want to recommend though is that some of this information, I work with you to get some of this information and then disseminate it to the residents. I think that could help a lot, because when I do get through a call and I find out what's happening, I find that most residents, once you can explain and bring them along, the ones that have to go and get nebulized or abandon their homes or look for somebody to take them in, they don't hear well after that, but the rest you could talk to. So I feel that if we could disseminate this information, I think that would be useful. My third and final question, Mr. Chair, speaks to the way human resources. Human resources is very important for any institution, yeah? There are a number of, this is probably my number 2 problem, incinerator at 1, appointments at 2, backlogs at 3. Thank the member for St. James South for asking that. But appointments, a lot of people are asking about their appointments within the QEH. A lot of people are concerned that they are scheduled 3 weeks on, 2 months off. And the problem is, they say that, well, the 2 months off, I can't feed my family, right? Now, my question is, does the Ministry of Health has any plans in relation to settling this HR issue? Or is this an issue that will have to be raised primarily with the Ministry of Public Service? How do I go about, as a member of Parliament representing a number of people who work in the QEH, located in the QEH, speak to these many people who have this dire concern where they're only getting work on an off basis and causing tremendous suffering for them and their family as they seek to put food on the table?
Thank you, Minister. I believe you are directing this question at QEH, or you're directing at the ministry and QEH?
Mostly people work at QEH, so it would be guided by you, Senior Minister, on...
I don't know the people that you're speaking about, so I'm just sure. I'm going to ask the Director of Human Resources of the QEH to speak specifically to these matters. Thank you.
Good morning. Susan Reeves, Director of Human Resources, QEH. Good morning. Susan Reeves, Director of Human Resources, QEH. During the last year or so, we would have appointed a number of persons within our establishment. We would have done approximately over 106 employees who would have been appointed, and we are now looking to appoint a further 97. During that course, what would happen, those persons that would normally be engaged more frequently, you will have less work because we are governed by our emoluments, which will have a number of posts which we can only utilize. So as a result, you will find that persons who would normally have maybe 3 months or 4 months in, they are no longer getting that period, those periods, because they have a number of persons who would have put into vacant posts. So we have those persons now in vacant posts, which would be permanently appointed to those posts. That would be 106, 2023. We would have done that also in 2021. That would be 202 persons, and now we're looking at 97 persons. We have currently another 20 posts or so, which we will be looking at for those persons to be appointed via satisfactory performances.
Mr. Chair, I'm very happy with the information. I pray that many of the persons who call are within that 97, There are about 6 or 7 of them that I prayed in that 97. So I am very, very happy with the answer there, and I think we can proceed. Thank you very much. And I want to say thank you again to the Senior Minister and his team for the information shared with not only me, but with the entire population of Barbados. Thank you.
Thank you, Honourable Member, and my advice would be to keep praying.
Thank you, Honourable Member. Honourable Member for Christchurch East.
Thank you, Mr. Chairman, for recognizing me. I don't know whether this was asked in my absence just now, but we are facing the stark reality that Barbados has an aging population. The stats show that it's of great concern, and we are increasingly being faced with persons who are suffering from either dementia or Alzheimer's or things like that. I have heard many stories of persons trying to get assistance or caretakers for their relatives who might be suffering from either dementia or Alzheimer's. And there seems to be a shortage of persons trained in dealing with people who have this particular issue. So we are in the process of constructing a new geriatric hospital. I know that there are facilities that I guess tend to address the concerns through the state. But we started a home health program, and we started other programs aimed at trying to assist persons in taking care of their elderly relatives. But I know from experience how difficult it is to find people who are competent and capable of dealing at home with persons who suffer from either dementia or Alzheimer's. So we're having the issue where in some instances it may be cheaper to try to deal with people at home rather than disrupt the person who's already bordering on some degree of confusion and trying to put them in an environment that is not familiar to them. If there was a structured way of addressing and managing those persons to give the family members a break, because these diseases are not only difficult on the actual patient or person with it, but they're devastating to households. They put the persons in the household who have to take care of the patients under serious stress, and quite frankly, it causes problems for them as well. So I'm just wondering whether there's a provision over the next year to expand the capacity to deal with persons who suffer from either Alzheimer's and dementia, and whether this also includes a program to equip people with the necessary skills to be able to take care of them in their own homes.
Thank you, Honourable Member. The matter you raise is a very difficult one indeed to deal with and to manage from the ministry's perspective. Management of persons with dementia and various stages of Alzheimer's is not an easy task. And you speak of training people I'll start with keeping people at home and having persons there trained. I know some persons try to deal with this matter at home, but then it becomes very difficult. And as persons with Alzheimer's deteriorate, it can become extremely difficult to manage when they become aggressive and threatening and accusatory in their beliefs. There's no immediate plan to assist people in training people at home. What I can tell you is that the ministry has entered a partnership with Chamberlain University to do 2 cohorts of 15 each, to have nurses pursue a master's degree in gerontology, to become nurse practitioners. So it's a mixed nurse practitioners / gerontology course. And this would certainly give them the skills that would be needed to manage and to do something like this. Certainly at this stage, the ministry doesn't have the resources to do that. This is something that is going to take, I believe, at least about 2 years to get the first cohort out. But the plan is that we have signed up to have 30 senior nurses go through this process. I'm going to let the Chief Nursing Officer speak in a bit when I'm finished. And that was a matter of dealing with persons at home and having them, nurse practitioners go to their homes and perhaps advise and the relatives how to deal with the situation. You made a point of some of these people, these relatives, needing to have some downtime and to recover. And we're looking at facilities that would allow for the accommodation of some of these persons on a temporary basis. Having said that, the Alzheimer's Association has been pursuing this and having discussions. There was an agreement, not a written agreement, certainly in terms of discussions, to assist them with the facilities that could be outfitted for the needs of those persons who suffer with Alzheimer and dementia. But there's no plans to do that in this year's estimates. I believe we were looking at the Gordon Cummings Hospital in St. Thomas, which is in a terrible state, some sort of not to rebuild and to work with the Alzheimer's Association so that government undertakes to renovate it, and that they take part and we assist each other in a symbiotic process to make it available for persons who unfortunately have developed Alzheimer's. So those are some of the things we're looking at. We recognize it. At this point in time, a lot of them are also managing our facilities. I believe we've been speaking about mental health, but the largest percentage of persons in patients at the psychiatric hospital are what we classify as psychogeriatrics. And this is a wide range, which includes dementia and Alzheimer's. So as pertaining to having solutions this year, not going to happen, perhaps in next year. When I say next financial year, I mean 25, 26. Thank you. The CNO to speak a bit on this too.
Good morning, Chair. Anastasia Jordan, Acting Chief Nursing Officer, Ministry of Health and Wellness. Honorable Member, as it relates to the training, in addition to the planned course for the nurse practitioner, you would be happy to know we also have a program at the BCC for nurses trained in gerontology, which has been ongoing for more than 4 years, where these nurses are specified, they're trained in specified areas relating to how we do treat to Alzheimer's, dementia, and to cater for the aging population of Barbados. In addition to that, there are many schools outside of Barbados Community College who deal with what we call auxiliary nurses, those support nurses, those caregivers mainly, to assist with the home situations to which you are speaking about. The General Nursing Council registers those caregivers so that they go through a curriculum which has been established and certified by the Nursing Council, so they have the skill sets that is necessary to be able to help those at home. So we know it is an issue. The aging population is indeed one that we are looking to address in the nursing profession, and it calls for a balance. And we are going to be looking at other ways, hopefully within the next 2 years or so, actually looking at having a gerontological program in the community to expand the services to also assist those persons at home who need that type of intensive care as it relates to nursing.
I hear you.
Thank you.
I hear you loud and clear. And in relation to the program of the auxiliary nurses, the difficulty here, I'm not trying to flog a horse. The difficulty here is that, as I understand it, to deal with people with dementia, you need people who can help to engage their minds, people who can deal with them a certain way, not just a generally trained auxiliary nurse or something. This person at a particular stage of their life with a particular disease that has to be dealt with in a certain way, you need to be able to engage them. The complaints that I keep hearing are that when you get people in, the persons don't actually know how to stimulate them, right? And we've had a number, even within our own grouping in here, the number of people with senior relatives who've expressed the frustration and the concern. This is not to point a finger at you or to suggest anything. It is simply that we have to deal with the reality of the situation we are facing. It's only going to get worse. So to me, some initiative, some encouragement, some incentive needs to be provided for this emerging and exceedingly relevant area, because there are a lot of people, right? People can't get the family into the geriatric hospital or the geriatric system, right? People are trying their best to deal with people at home, and it is frustrating a lot of people. So I'm just suggesting that this may be something that needs to be considered as a priority area for development or facilitation in Barbados.
Mr. Minister, I must I spoke to this and I said that we are having nurses to specialize in gerontology. It's a gradual process. I heard you mention auxiliary nurses.
No,
That's not what I'm talking about.
The senior nursing officer is the one who had mentioned the auxiliary nurses as a way to bridge that gap. So I was actually...
I understand that you're talking specifically about Alzheimer's and those other things.
Correct.
Which need special. I don't know that the auxiliary nurses is what I was thinking about when I responded.
I'm on the same page as you, Minister.
I don't know that you are, because I don't know that we have the resources to do everything at all in the same time. Right now, as I said, some are accommodated at the psychiatric hospital, some are accommodated in the geriatric. We have the alternative care, the other program, which government funds to accommodate a number of them. So I take your point, but I wouldn't want it to go abroad that the Ministry of Health and Wellness is not really doing anything about it. I went further to say that we have had discussions regarding providing and refurbishing Gordon Commons to meet the requirements, and we are working with the Alzheimer's Association. So I wouldn't want the impression to go out there that we are just neglecting and not looking at Alzheimer's treatment. And from your tone, with respect, I get that impression.
Minister, I'm sorry that you heard it that way, and rest assured that was not my intention. I took great pains to point out that I'm not attempting to assign any blame to anyone. So just for the record, that was not the intention. I was expressing a concern that was raised and asking for clarification, which you did clarify. Thank you.
Thank you.
Second question. Let me start by saying that I want to express my gratitude to the Randall Phillips Polyclinic and those who operate within its capacity. I have found that your services and your officers have been quite responsive to numerous complaints from the catchment area. And I've become very familiar with Mr. Chapman. And I find that when we raise issues, they're dealt with very quickly. So I'm just asking here now, in relation, while we push to get the legislation done that deals with the nuisance and the regulations that deals with making property owners responsible for their properties, is there any way or any provision that we can accelerate the inspections and prosecutions until such time as that happens? Because quite frankly, when I saw the flurry of prosecutions about 2 months ago in the newspaper, right, in one, you saw people cutting and dealing with their properties. So just the fact that persons were charged in the paper, a flurry of activity started. It has died down a little bit. So I'm just wondering if there's any provision for an increased inspection and response to the issues that are being reported, especially as we are now approaching the start of the hurricane season. So the grass and the overgrowth yields its own complications in the hurricane season, not just with the mosquitoes, but also with flooding and inability to control the flow of water into the areas it's supposed to go.
Thank you, Minister. I accept your praise of the Randall Phillips, but
high praise.
But I also am going to speak before Mr. Chapman, because I know that he's not attached to that catchment area. He's attached at the central ministry, and I don't know that he spoke extensively on this matter this morning. And it gave that we are already, that they've been serving notices and they have prosecuted a number of people this year. I know because they come to the minister to sign off for persons to be prosecuted. So it is something that they're already doing. And as part of the vector control program, they are doing more inspections. I know because I accused them of not doing enough before, and I've seen increasing numbers. So perhaps Mr. Chapman will want to add.
Yes, Minister. Ronald Chapman, Deputy Chief Environmental Health Officer. Minister, Honorable Minister, I understand where you're going with this, and as I mentioned earlier, it is important that we look readily at the recommended legislation, amendment to the legislation, and that those recommended amendments are designed to speedily, to really increase the speed at which we're able to deal with these issues. So I don't want to rehash myself again, but I think we need to be able to address that and address that quickly, and we'll be able to see these problems being addressed in a much quicker manner.
I close, Mr. Chair, simply by saying I appreciate the effort and the work in the Ministry of Health. There's some ministries that are easy to point fingers at because of the scope and the fact that, quite frankly, for example, the Ministry of Health, everybody at some point in time collides with the Ministry of Health. Everybody. So while people may not always collide with MTW, while people may not always collide with environment, while people may not always collide with, I don't know, home affairs, every single person in Barbados at some point in time has to experience one of the facilities or services offered by the Ministry of Health. So it is easy to point fingers, but I think people, if they're honest, can see the improvements in some respects in the healthcare in Barbados. And actually, I can personally say that I have noticed an increase in the responsiveness when I've reached out to certain departments within the ministry. And just for clarification, Minister, the reason I call Mr. Chapman is because, unfortunately, he's one of them people who, like, every ministry has them. You go to that person, and then that person either directs you to who exactly to go to, or they will make the call themselves and the things will happen. So Mr. Chapman's facility has probably been abused by many of us, right? So I know he's not attached to Randall Phillips, but I was just appreciating the work that he has done and the work that he has done in collaboration with the Randall Phillips to address the concerns in our catchment area. So having been properly and thoroughly answered with those two questions, I don't need to ask a third.
Thank you, Honorable Member.
Thank you, Honorable Leader of Government Business.
Thank you, Mr. Chairman. I beg to move that you do now report progress to His Honor the Speaker and beg leave to sit again.
The question is that I do now report progress to Her Honor the Deputy Speaker and beg for leave to sit again. All honorable members in favor, say aye. Honorable members against, say no. We think the ayes have it.
Honorable members, your chairman has reported progress and asks for leave again.
Thank you, Madam Deputy Speaker. I beg to move the suspension of the House until 12 p.m.
12. The question is that this honorable chamber be suspended and asked to sit again. Be suspended until 12 p.m. Honorable members in favor, please say aye. Those against, please say no. He thinks the ayes have it. This honorable chamber is suspended until 12 p.m.